Further debate? Member from Thornhill.
Here, here.
Thank you, Mr. Speaker. I think that the key today, the fact that we're visited by all of the doctors that I really appreciate came down today, is that the doctors feel disrespected. They don't feel valued, and I have to agree with them, Mr. Speaker, because if you go to school for an average of 11 years post-secondary, and you have huge debt, and you didn't just go to school, you were working for practically minimum wage, training in hospitals. You were very competitive in high school to get the marks, to get into medical school, and everything that you've dedicated your life, you care about your patients, you care about your staff, you care about your neighbourhood and your families. We know so many doctors who also volunteer in their communities. They're community-minded people, but they also deserve our respect and the respect of their patients, as well as the government and all the bureaucracies. And when the doctors are being told more money is being put into health care, but we are cutting your service fees, they are insulted. It's plain and simple, Mr. Speaker. They are insulted because, yes, they understand that the population is aging. They understand that there are new treatments that are more expensive, that patients are living longer, that we can do more for our patients to keep them living longer with a better quality of life, but that it costs. And they expect the government to plan for this. They don't expect to see money wasted on e-health when the government could have very easily gone to Alberta. I implemented electronic health records in a medical clinic myself. I know it's not easy. I know it's expensive. But this government managed to spend close to $2 billion and not achieve its goal when Alberta had already achieved the goals, and the government could have easily gone to Alberta and saved all that money. The government didn't have to move the gas plants, and it could have saved the billions of dollars. The government didn't have to give bonuses to Pan Am executives, and the list goes on and on, Mr. Speaker. So the reason the doctors came down today, the reason the doctors feel disrespected is because they see money being spent on things outside healthcare and inside healthcare, yet their fees are slashed. They are treated as government employees when it suits the government, and as small business owners the rest of the time. And maybe the doctors made a mistake when they went into this model of Medicare, in that they didn't insist on the government paying for their rent and hiring and training their staff. They spend hours every week just doing paperwork, just paying bills, just dealing with landlords, training staff, and then staff come to them, and we've all been through it where staff have health problems, they have family issues, perhaps a staff member is pregnant and it's a technician who has to work a machine. It's not easy to find somebody and to train somebody. Doctors often spend 6 months training a new staff person just to have that staff person say, you know what, this job is too stressful, I'm going to work somewhere else. They had to pay from their OHIP billings, their service fees, to train that staff person. Doctors are told, who are in, say they're in some kind of family health team, if their patients go to see another doctor, their fees are cut. Why doesn't this government consider implementing a system where if you don't go to the doctor that is rostered to be your doctor, that maybe you have to pay out of pocket? Maybe you have to pay for that second opinion. Maybe the government has to fess up to the population and admit it doesn't have the money for first-rate health care in the province of Ontario, and this is the way they've decided to budget, is they've decided to budget that everybody can see just so many doctors per year, or they can only see a specialist once per year, and that patients are going to have to somehow get health insurance or somehow cover it out of their pocket. The government doesn't want to do that, and that's why it's so insulting to hear the Minister of Natural Resources and Forestry speak about that somehow the opposition, de motion, is playing games and trying to score political points. The fact that the government has decided to try to balance their healthcare spending because they've hit a brick wall in terms of their spending capacity, that they're trying to balance it by cutting and slashing doctors' fees, is exactly because they are trying to politically solve the solution without upsetting patients. If they try to limit access to health care, well, that's a lot of voters. That's a big voting group. Doctors cannot go on strike, and doctors wouldn't go. We know that our doctors wouldn't go on strike even if they had the right to strike. We are well aware of that. We are well aware that the doctors wouldn't do some kind of work to rule the way we've seen with other public sector workers. They wouldn't say to their patients, no, I'm not giving you a renewal for your prescription. I'm not rewriting the prescription that you lost on the way home from your visit to the doctor. Why don't I send it to the Ministry of Health and have you get it from them? Doctors don't like having to say to patients, that's not covered by OHIP and you're going to have to pay. Many doctors are capable of doing that. They're capable of charging service fees to their patients for things that have already been shown to not be covered by OHIP services. They don't like doing it. They don't like nickel and diming their patients, but they also want to be fairly compensated for the average of 11 years that they go to post-secondary education, for the years of training, for the nights of call, for the calls that they take that they're not paid for, all the phone calls. Many patients, they have children who don't speak to each other, so you speak to one child and the parent has Alzheimer's and you explain whether they can handle having surgery or not, and then you have to speak to the other child. This is hours and hours every week that our doctors spend on the phone, spend in person, just trying to counsel that they're not compensated for, Mr. Speaker, and they're not asking for more money, but they're also not asking to see their fees slashed. It's not just about the money in terms of the fees. Yes, they do have expenses to pay. It's a kick in the head. That's what's upsetting them. That's why they take time out of their busy lives. We saw some doctors came with their children today, which reminds us that they have children who want to go to hockey, like my colleague here. They want to take their kids to hockey. They want to take their kids and see their kids in the school play. Well, it's not easy to take time off when you have sick patients who have appointments. You have emergencies, you're on call. We've heard doctors speak to us about getting ready to go home from the hospital after a long day and then seeing an emergency come in and realizing that there's not enough staff to deal with so many emergencies at the same time, and they decide to stay and help out. That's the doctors that we want in this province, Mr. Speaker. That's the doctors that our patients, that the patients of the province deserve. And I think that we're put here as parliamentarians to ensure that the priority is health care, and the best health care. And if too much money is going to bureaucracies, then we have to address that. And we don't need necessarily to build always more hospitals. Yes, some areas are underserviced in terms of hospitals, but perhaps maybe with existing hospitals we can have surgeries go on in the evenings or surgeries go on in the weekends. That a lot of times patients are misled by politicians in thinking that a new hospital in their area is going to mean more access to health care. Well, a new hospital needs doctors and nurses and equipment to run, and sometimes we're better off putting more equipment, more doctors and nurses into an existing hospital rather than just building new hospitals, unless we have put aside the money. Obviously, we prefer new hospitals, but we also have to have the money in place to have adequate healthcare professionals and equipment to run those hospitals. So I think that, to wrap up for this side of the House today, I just want to mention very quickly that the Ontario population at 13.6 million, with 320,000 patients treated per day by our doctors, 5.9 million patient visits to emergency rooms every year, 59 million patient visits to family doctors, 57 million patient visits to specialists, and 50 hours of work per week, most of the doctors, and 22 hours a week of call. And all I want to say from this side of the House is thank you, thank you, thank you. We couldn't have the type of province where people all over the world, they don't just want to come to Canada, they want to come to Ontario. And one of the reasons is the fantastic healthcare system we have. Thank you very much, Mr. Speaker.